All right. So happy Friday, friends. Let me get connected over here and we'll get started with today's Friday facts. Okay. So, hi, friends. Welcome to my Friday Facts Live series. I am Dr. Shayla Toombs-Withers, plant based physician owner of Essence of Health Wellness Clinic and Coaching. As a physician, board certified in family medicine, obesity medicine, and with a certification in plant based nutrition, I teach motivated professionals how to achieve sustainable health and wellness with a mind body balance approach in an effort to prevent and reverse their chronic preventable health conditions. On today's Friday Facts, I wanted to highlight cervical cancer awareness. I have been in Puerto Rico this week, as you can see this lovely site behind me, attending the Hello 7 ROI Summit. It's a business conference for women and historically underrepresented entrepreneurs. Being amongst and inspired by so many different women of various backgrounds, nationalities, cultures, and field of expertise, it's been just quite a wonderful experience this week. Now, so today's Friday Facts are dedicated to you as we women have to keep ourselves and the other women in our lives healthy for generations to come. Now, did you know that cervical cancer is preventable with proper screening and vaccination? If you are biologically female, then you are at risk for cervical cancer. I have a few questions for you that I want you to ponder. One, are you up to date on your pap smear? Two, when's the last time you saw your primary care doctor or OBGYN for a wellness exam? Three, have you ever had the human papillomavirus or HPV vaccination? Four, did you even complete the vaccination series? Now, if you don't know the answers to these questions, or if you're unsure about the answers to these questions, then definitely keep listening today. Here are the latest cervical cancer screening recommendations from the American College of Obstetricians and Gynecologists, or ACOG. So, ACOG recommends that anyone with a cervix start having cervical cancer screening at age 21, regardless of when you first start having sex. Furthermore, how often you should have cervical cancer screening and which tests you should have depends on your age and health history. So let's break this down. Women who are 21 to 29 should have a pap smear test alone every 3 years. HPV testing alone can be considered for women who are 25 to 29, but the pap smear test is still going to be preferred. Then for women who are 30 to 65, you have three options for testing. So you can have a pap smear test and an HPV test, which is called co-testing, and you can get that co-test every 5 years. You can have a pap test alone every 3 years, or you can have HPV testing alone every 5 years. Women over the age of 65 no longer need cervical cancer screening after if they meet these certain guidelines. So if they don't have a history of moderate or severe abnormal cervical cells or cervical cancer, and then two, if those women over 65 have had either 3 negative normal pap smear test results in a row, or 2 negative and normal HPV tests in a row, or 2 negative and normal co-test results, which is where you do the pap smear and the HPV test together in a row. And that's within the past 10 years. And then the other key to that is remembering that the most recent test should have been performed within the past 3 or 5 years, depending on the type of test that you had. And so if you meet those guidelines over the age of 65, then you no longer necessarily need cervical cancer screening, but you would definitely want to discuss your situation with your personal doctor. Now, another thing I do like to highlight is that women who have had a hysterectomy may still need cervical cancer screening. Sometimes people think that, just because they've taken out all of these parts, then I don't need this screening, but that's not necessarily true. So you definitely would want to talk to your doctor about this because the decision is based on whether the cervix was actually removed with your hysterectomy, why the hysterectomy was even performed, and then whether you had severe cervical cell changes or cervical cancer itself at the time. Now, also keep in mind that even if your cervix is removed at the time of your hysterectomy, cervical cells can still be present at the top of the vagina. So if you have a history of cervical cancer or high-grade cervical cell changes, you should continue to have cervical cancer screening for 20 years after the time of your surgery. Another little known fact that I like for women to keep in mind is that you can still get HPV, human papillomavirus, and be at risk for cervical cancer even if you aren't having sex. So, any genital contact, whether it be with someone of the opposite sex or even the same sex, can spread HPV, and this can increase your risk for cervical cancer. So, screening is still important regardless of if you're sexually active or not. Now, the HPV vaccine is one of the best preventative tools that we have for cervical cancer prevention. But keep in mind that while it prevents most common cancer causing strains of the human papillomavirus or HPV, it does not prevent all of the types of HPV that may actually cause cancer. The HPV vaccine is recommended for routine vaccination of both boys and girls at age 11 or 12 years old. And this is because HPV can also cause some other health conditions. So it's helpful to have this level of protection. Now, the HPV vaccine is recommended for everyone through age 26 years old, but it can also be given to those over the age of 26 and up to age 45 years old. HPV vaccination, it prevents new HPV infections, but it does not treat existing HPV infections or diseases. So keep that in mind. And then the HPV vaccine, it does work best when it's given before any exposure to HPV. So if you are over the age of 26 and you've never received the HPV vaccine, then it may be worth it for you to discuss it with your doctor to see if this is something that may be helpful for you. Now, Essence of Health Wellness Clinic and Coaching does offer women's gynecological exams, including cervical cancer screening. So if you are not up to date on your screening, then schedule an office appointment with me or your personal doctor today so that you can get screened. Remember also that services at Essence of Health are available to those near and far from my physical office location, and that I do offer in-person as well as telehealth visits. And then in the Essence of Health Signature Health Coaching Program, I teach you how to healthfully eat for sustainable health, wellness, and weight loss, utilizing a plant predominant diet, appropriate movement, and mindset strategies incorporated to help you achieve your health goals. You can grab a copy of my free ebook for more health tips at essenceofhealth.link/e-book. And I'll place this link in the comments for you. And then I do invite you to learn more about me and Essence of Health Wellness Clinic and Coaching at eohcoaching.com. You can also tune in every Tuesday to my podcast, the Essence of Health Tea Time Podcast, on your favorite podcast app for all things health, wellness, and plant-based nutrition, or follow me on social media at Essence of Health Wellness Clinic on Facebook, Instagram, and YouTube, or Dr.TW at EOHWC on TikTok, and Shayla TW on LinkedIn. I do look forward to working with you, and I offer a free strategy session to chat one-on-one about how I may be able to help you achieve your health goals this year. Remember, the essence of health is in you.